Your hip bone is made up of 3 separate bones fused into one. The pubis, ilium, and the ischium are all attached by the triradiate cartilage. Your hip joint is a ball and socket joint, a joint which allows maximum movement, where a rounded bone covered in cartilage is attached to another rounded out bone covered in cartilage and fat, all supported by a tendon. The hip joint is one of the most flexible joints in the entire human body. The muscles of the hip provide movement, strength, and stability to the hip joint and the bones of the hip and thigh. These muscles are called the abductor group, made up of the abductor brevis, abductor longus, abductor magnus, two gradus, and the pectinus. They are attached from the femur to the hip and provide stability to the hip joint. The iliopus group consists of the ilius and psoas major, attached to the hip bone from the spine, L1 and the L5 vertebrae. This is the lateral rotator group. The externus and the internus arbitrators, piniformis, superior and inferior gemelli, and the quadris femoris, all attached to the hip bone.
This hip stretch addresses multiple muscles and planes. Tightness around the hip joint and hip muscles is very common among athletes and will restrict full movement and optimum performance.
Lunges include the hip flexors, psoas major, psoas minor, and iliacus muscles, all of which insert the lesser trochanter of the femur. The iliotibial band is a thickening of the fascia lata, the deep fascia of the thigh. Think of it as a thick, long ligament like a structure that connects the hip to the lower leg along the outside of the thigh. Tightness in the iliotibial band can cause patellofemoral knee pain, traumatic bursitis, and the friction syndromes at the knee.
The squat is a compound full-body exercise that trains primarily the muscles of the thighs, hips, and buttocks, quadriceps, hamstrings, as well as strengthening the bones, ligaments, and insertion of the tendons throughout the lower body.
Hip rises help stretch the rotisserie in your hip. This helps stretch the back rotisserie of your hips.
Side leg raises help stretch the joints and ligaments attached from your hip to your femur.